Officials have confirmed the first cases of the Omicron COVID-19 variant in Canada, as the World Health Organization warns transmission of this new strain could lead to severe consequences. Experts are saying the world is in a race against time, with countries shuttering borders and tightening restrictions.
The latest 4 cases have now been confirmed in Ottawa. These 2 people traveled from Nigeria to Montreal. 2 other possible cases in Hamilton are undergoing sequencing to confirm whether they are the new variant. So many questions and just not enough answers. To help us understand what we do know, we want to welcome to CP24 Tonight Dr. Abdu Sharkawi, infectious diseases expert at Toronto Western Hospital, and Dr. Barry Pecos, a global health expert at U of T and York Region's new medical officer of health. Thank you both for being with us. Dr. Sharkawi, we'll begin with you. We're hearing from a lot of medical experts today saying this is not the time to panic, that we have to wait for all of the information. I know you've been doing a lot of research on this new variant of concern. What stands out to you?
I guess what stands out is just how quickly we're seeing new cases emerging in various countries around the world. And perhaps this is a telltale sign of what we're about to see in coming weeks. And if all indicators appear to be what they are, it's very likely that this could become the dominant strain and overtake Delta. But I think it's important to be mindful of the fact that we don't know that it's any more virulent, that it's going to be any less compromising in terms of its response to vaccines. And we should remain vigilant with our eyes squarely fixed on what we know works, which is maintaining an aim for vaccination at the highest levels and masking appropriately and ensuring we're in well-ventilated settings. That's something that we know works regardless of what the variant is, regardless of what our vaccination status may be. All of those things help. So let's keep ourselves focused on what we do know while we're gathering facts around what we don't know.
Dr. Pecos, is this an opportunity to make an effort to vaccinate the world? We focus on vaccination rates in the city, in the province. Is this what we should be looking at now?
Absolutely. Just over the past couple of days, there are renewed calls, as there have been for quite some time, to be sharing vaccines around the world and recognizing that until everywhere around the world has vaccine rates comparable to ours in Canada and some other places around the world, we're not all going to be safe from a new variant evolving just like it has. That said, countries who have had vaccinations, quite successfully, including Canada now, it's a bit of a wake-up call for those who either are eligible for the 3rd dose or for those parents who are, still hesitating a little bit with their kids to go out and get those vaccinations done now as we're, moving into the holiday season, to make sure that we have a, successful and safe holiday season and into January.
Dr. Sharkawi, late today we heard from the CDC now recommending all adults in the U.S., anybody over the age of 18 should get their booster shot. Should we be rushing to do the same in this country?
Well, ideally, you want everybody to get as many shots as they can and to maintain immunity before it wanes. I think that we have to balance who we are giving additional doses to against what's going on in other parts of the world. It's difficult to reconcile that we would want to give a perfectly healthy 18-year-old a booster dose if they may not be in a high risk situation, when there are parts of the developing world where 60-70% of the population haven't even gotten to dose number 2. So I do think there is certainly room for expanding of eligibility, perhaps maybe to people who are over the age of 50. I'm not so sure that it makes the most sense from a vaccine equity point of view and a global perspective to be expanding it to those that are over the age of 18.
Dr. Sharkawi, I want to ask you, as an infectious disease specialist, is it that we need the transmission of this new variant to understand its virality, to understand if our vaccines will hold up to it?
Absolutely. A lot of the panic and probably alarm was raised because of the number of cases which were identified fairly quickly in South Africa. But that was in the context of a fairly poor vaccine uptake. And we don't know that we're going to see the same sort of transmission in parts of the world where vaccine uptake is pretty good, and that includes here in Canada. So we're going to want to see how that plays out. We're going to want to see how symptomatic cases manifest. Are they relatively mild, or are they going to be cases that are more likely to land people in hospital or in ICU? We simply don't have the answers to that, but we will know fairly soon. At some point in the next 2 to 3 weeks, we will have all of those answers and a pretty good handle on who's at risk and why.
Yeah, of course, everybody waiting for that information. Dr. Pekis, it does seem like things are happening fast in the UK. They're investigating hundreds of suspected cases. Did you like what you heard from our medical officer of health today? What should Ontario be doing at this point?
Sure. Dr. Kieran Moore, outlined a number of things that we're going to be doing, including testing and more aggressive case and contact management for those who we know came across the border, might have flown in. And a really important element of what he mentioned was that we are considering lowering the age for booster doses. I think that's something lots of people are interested in. And I certainly agree with Dr. Sharkawi that, the 50-year mark is a good idea. We want to protect those people who are at higher risk, either those who are vulnerable or are older. And we may not want to use those doses for younger people just yet, although we do have quite a few doses in Ontario that would be difficult to ship elsewhere. But it's, global health equity is a really important consideration.
I wonder also, Dr. Sharkawi, on infectious diseases, how have the other variants held up to our vaccines? Have they been challenging? Is this going to be difficult for us going forward?
I don't think we have any evidence so far that suggests that is the case. I mean, I think we've learned even with Delta that as long as the vaccines are dosed at appropriate intervals, particularly in higher risk populations, we do fine, as long as that's coupled, obviously, with responsible public health measures. There's obviously some concern because of the number of mutations that have been identified in this new Omicron variant that may confer some difficulty with respect to immune evasion, but it's highly speculative right now. We simply haven't had any real-world evidence to suggest that that's translated into compromising our vaccine efficacy. So it's going to take a little bit of time to identify that, but I'm fairly hopeful that that's not going to be the case, that we're going to be okay, provided we remain vigilant. We've still got to keep masking and maintaining good ventilation standards. All of those things are going to serve us very, very well, regardless of what variant challenges us.
Yeah, and I think that's important for us to remember, Dr. Pekis. There are a lot of people holding their breath right now, waiting for more data. Christmas, the holidays right around the corner. A lot of people have made plans. Do you have any advice for Ontarians?
Well, certainly for those who are not traveling, aside from the Omicron variant, we have seen a pretty significant increase in cases now, 3 weeks before the holiday, and that doesn't bode well going forward. So I think, as Dr. Sharkawi mentioned, all the public health measures we need to keep in place, and critically important, if anybody who's hesitating to get vaccinated now. With respect to people who are traveling, it is taking a risk. Either booking those tickets or not canceling them. It's really quite uncertain what borders are going to close, what will remain open. Several countries have closed them already. Several have closed them just for 2 weeks to see how things go. It's hard to imagine that those are going to get reopened. Everyone's just going to have to weigh those risks and benefits for themselves. I think it's more of a risk of losing your money out or getting stuck in a place where there might be Omicron that's transmitting, and then you're not able to leave again. And I think most people would want to avoid that, which is, it's very unfortunate at this time of year, but people may have to stay at home and enjoy the holidays here.
And what would you say to anyone, Quebec is saying don't travel at all because they're concerned about Omicron. So when you're gathering with your family, should you be indoors? Should you try to stay far away or limit it to, a meal around a table and everyone disperses? Dr. Pekis.
So there's no doubt that we should make sure that we should be, vaccinating before gathering, particularly indoors. That's something that we've had advice around that for quite some time, and people who aren't vaccinated still have a chance to get vaccinated before the holidays now. In terms of ventilation, we want to make sure that you have good ventilation, whether that means opening windows, even though it's a little bit cold, and certainly wearing masks when you're not eating. And, spending a minimum amount of time together maskless is going to be really important. And people should just watch the numbers, and we'll see how things go over the next couple of weeks. It's also about thinking about your risk potentially of family members or friends who may have encountered other people who may not be vaccinated or who may be higher risk as well. Just thinking about everybody who you're inviting to your table, whether or not they're vaccinating, and what risks they may be exposed to.
And Dr. Sharkawi, we'll let you have the last word. Would you travel right now, and how would you spend your holidays?
Personally, I wouldn't, for the same reasons that Dr. Pecos mentioned. I think that you're taking a risk just in terms of the hassle and the stress that it might involve, whether you're stranded somewhere. And don't forget, traveling, it's not just the risk of being on a plane necessarily. It's the risk of being in a crowded airport and being in long lines and people getting tired of wearing their mask and maybe removing it for periods of time. Those lapses are not insignificant. And over the course of a long trip, waiting in an airport both ways, that could become something that you want to think about. So personally, I think it's a staycation for now, and hopefully look forward to maybe better times ahead for March break.
Okay, fingers crossed. Dr. Abdu Sharkawi and Dr. Barry Pecos, thank you so much for your insight tonight. We certainly appreciate it. Ryerson University is continuing to seek community input as it goes through the process of changing its name. The community is invited to share their opinion with the university's renaming advisory committee for until next Tuesday. It can be offered through using an online survey or by sending an email. The committee is in the process of developing a short list of potential names for Ryerson.
The name change was one of the 22 recommendations put forth by a task force and accepted by the university's Board of Governors back in August. The task force addressed the legacy of Egerton Ryerson, one of the architects of Canada's residential school system. His statue at the university was toppled during a protest back in June. A newly formed group called Friends of Egerton Ryerson says a task force which recommended the name change made serious errors.
And the group is also defending Egerton Ryerson, arguing he spoke Ojibwe, supported the bilingual voluntary schools established by Ojibwe leaders, and had nothing to do with the federally imposed residential school system. To discuss, we're joined live on the phone by Rose Dyson with Friends of Egerton Ryerson. Thanks so much for being with us, Rose. I understand this group has written to the Premier about this, outlining some of its concerns. Tell us more about that and what you're hoping will come out of this letter.
Well, we've sent a letter to Doug Ford as the Premier of the province and party leaders because it's our understanding that there will be provincial legislation required to have the name changed. And in this letter, we indicate it's been signed by over 38 people, many of them former faculty and graduates and other members of the community. What we stated in this letter is that the task force that recommended the name change made some serious errors, and that the Board of Governors at the Ryerson failed to conduct a proper review of its findings before deciding to go along with its recommendations. There were numerous briefs presented in support of Egerton Ryerson and look at his life and legacy demonstrates that he spoke Ojibwe. He had an Ojibwe name given to him by a chief as a brother. He lived among them for a period of time. He supported the bilingual voluntary schools that were established by the Ojibwe leaders themselves and had nothing to do with the later federally imposed residential school system. So what this does is calls the whole process into question in terms of the governance of Ryerson University, and so we're calling for a review of how these decisions were arrived at on the basis of the information gathered.
Have you followed the 10 months of the process so far?
Well, I have, as a member of the public or resident of Toronto, I've been certainly aware of the unfolding concerns around the accusation of Ryerson having founded the residential schools. So to that extent, yes, I have followed the debate and the controversy.
Well, in the newsroom, journalists aren't saying that he founded the residential school system. He's been dubbed one of the architects. He was a prominent figure in the creation of the public education system in Ontario. We can agree. It was during the 1800s. Maybe it was a reflection of society then. It's not a reflection of society now. But his role did help prepare the ground for these kinds of schools.
Well, look, the Ojibwe, in those days, there was very little education amongst the public at large. Ryerson was instrumental in setting up a public school system in Ontario, and it had an impact on how they were established throughout the country. The Ojibwe people wanted these schools as much as their white counterparts. So it was not something that was imposed on those. Those were times where the old traditional ways of making a living were disappearing for the indigenous people of the day, and they wanted to learn the ways of agricultural and so on. And that's something that Ryerson helped them with. He was not imposing anything on them that they didn't themselves want.
Right, but it's many Indigenous people who are calling for this name change. We all saw the protests. There's a lot of anger surrounding this. As Rashmi noted, Egerton Ryerson is considered one of the architects of the residential school system. Can you see how this looks, though? A lot of people are angry about this. They're hurt, and every time they hear his name, it brings them pain. So what do you say to the people?
Well, we think a lot of these people have been misled by an egregious distortion of the facts. And when you say there are a number of Indigenous people calling for his statue to be toppled, which of course it already has been, and the name change, there's also a number of people, Indigenous people, who are in support of Egerton Ryerson and keeping the name and disagreed with the statue being taken down. As if you go, anybody that wants to go to our website can read some fairly lengthy discussions of this, and one of them in particular, Professor Fontaine points out that over half the people, Indigenous people in the country today, identify as Christians. I think that underscores the kind of fusion there has been over the years or the generations in between the colonial ways, if you like, and the more traditional residential ways. So
sure, Rose, we're running out of time here, and I just want to point out that we're not going to get a unanimous decision on anything in society, but we are hearing from people in 2021 who are affected by the name Egerton Ryerson. Are we teaching Canadian history properly if you believe some people are misinformed?
No, I don't think we are. I think there's far too much acceptance of alternative facts, if you like, or revisionist.
We don't like.
And no, we're not very happy about that. One of the stated purposes of this task force was to enforce and maintain what I quote as today's more inclusive and humane value system. Well, that's fine, but on the other hand, what was completely ignored is the potential enrichment to knowledge and learning facilitated by historical perspective. So the mores and the sins of the colonial past in an odd way are being appropriated and reapplied in a different context. So that doesn't really amount to true reconciliation.
Okay, Rose Dyson, we'll have to leave it there with the group Friends of Egerton Ryerson. Thanks so much for your perspective tonight, Rose.
Thank you for encouraging me to do this.
If you have travel plans this holiday season, there's a good chance Omicron is making you a little nervous. Travel agents all over the country have been fielding questions surrounding this new variant of concern.
Others have decided to cancel their travel plans altogether. Here to help you cope with the anxiety surrounding all things COVID and travel is Shamala Kiru, a registered psychotherapist. Good evening, Kamala. Thanks so much for joining us. It's good to see you again.
It's great to see you guys as well.
I think the word of the year could be uncertainty. There's certainly so much of it around this new variant of concern. You know, people have booked flights to see their family, their friends, to get away. And now they're nervous. What would you say to a client struggling with this kind of anxiety?
Yeah, and I think you're absolutely right. The word of the year is absolutely uncertainty. I think over the last 18 months, almost 2 years, we've had to come face to face with the discomfort, the anxiety, it's uneasy to be uncertain for such a long period of time. So one of the things we often talk about with clients when they're trying to manage the anxiety that's associated with uncertainty is really to develop a bit more of a flexible mindset. So we really need to, I think now more than ever, adopt that flexibility in our thinking, adopt that flexibility even in our planning, adopt that flexibility as we're thinking about, as we approach the holiday season, perhaps what the holidays will look like when we're thinking about travel plans. Really, we've sort of seen this, if you think about it, throughout the pandemic, right? Throughout the last almost 2 years, we've seen the need to be flexible as we move from season to season, as we move from holiday to holiday. We've seen it with back to school. We're seeing it again now with travel plans and the holidays coming up. It's really that ability to be flexible, to make accommodations, to shift on those plans if we really need to. Because one of the things that happens for us with uncertainty is we try to hang on to control. We try to have as much control as possible. And we know that unfortunately, during these, really difficult times, there is in some ways very little that we do have control over.
Shamala, in terms of flexibility as a mindset, some people are quite nervous when it, of course, comes to their own health, and they have serious concerns and anxieties surrounding that. So someone who may already be concerned about traveling and, any stresses that come with that, plus we know the holiday season tends to exacerbate people's anxieties. Now there's a concern about potentially becoming ill. What do you suggest to people? I mean, flexible thinking is a great idea, but sometimes people need perhaps an action plan, or what should they do in the moment if they're feeling that kind of anxiety, or if they do become ill while they travel?
Yeah, I think let me address the anxiety first. So I think the first thing is to really be able to make a decision that you can own and commit to. So it's really maybe pausing and asking yourself, are you prepared to travel during this time? And what that will mean is there's going to be certain accommodations you'll need to make during that travel. It might mean that your levels of anxiety, your levels of nervousness or fear around that travel are increased. And if that's the case, then it will definitely mean that you're going to have to put some practices in place in order to reduce that anxiety. So those could be things like visualization. It could be really getting clear and concrete on what parts of the travel you can control, what parts of managing illness you can control, versus what are the parts that we can't control. I think that anxiety becomes heightened when we don't differentiate those factors that we can control versus the factors that we cannot control. So we know that when we focus on factors that we can't control, anxiety actually increases. It actually becomes overwhelming. It becomes a lot worse. And so putting those practices in place can really make a significant difference.
There are some people who've decided they will travel this holiday season, and then there are people who've decided to cancel their plans. And that's not an easy decision to make either, right? For some people, they haven't traveled in 2 years. How does that impact somebody's mental health, Shamala?
Huge. I was just talking with somebody earlier today about all the different ways our mental health has been impacted. But, not being able to travel, not being able to be in a different environment, perhaps not being able to see family and have those connections is having such a significant impact on our moods. I think what's happening now, what I'm seeing, sort of December 2021, is there's this mental fatigue that's coming over so many of us. And part of that, I think, is decision fatigue, right? Making these difficult decisions over and over again. Do I move forward with this thing that has risks associated with it, or do I remain isolated, right, in order to remain safe? And making those decisions over and over again, it's exhausting, right? We're becoming really tired of all of this. And I think our capacity to make those decisions well is decreasing as well, right? It's becoming harder to make those decisions. So either way, at the end of the day, I think we really need to think about what's going to be best for us, what is going to be the best decision for us. And regardless of which option we choose, we need to come up with a plan. We need to think strategically about how I'm going to manage the pros and the cons, the risks and the benefits of either one of those decisions.
Yeah, and it's so important to reach out and ask for help if you need it, because it certainly hasn't been easy. Psychotherapist Shamala Kiro, thanks so much for your expertise. We certainly appreciate it.
My pleasure.
We're monitoring the immune benefit at a population level from these vaccines and at 8 months out. For the general population, so 50 and less, we are seeing ongoing good immunity, but we want to be able to provide the third doses in a timely fashion before the immunity fades, especially as we're seeing an increase in cases related to Delta and the potential threat of Omicron to our communities as well.
With a new variant of concern now clearly circulating in our communities, provincial officials announced today 4.6 million more Ontarians will soon be eligible for their third shot of the COVID-19 vaccine. Starting December the 13th, anyone 50 and up who got their second dose at least 6 months ago will be able to book their booster.
But can family doctors and pharmacies handle the onslaught of demand? And will this third dose help us overcome Omicron? Let's find out, with our panel. We welcome to CP24 Tonight the Chief of Family Medicine at Markham Stouffville Hospital, Dr. Alan Grill, CEO of the Ontario Pharmacists Association, Justin Bates, and infectious diseases specialist, Dr. Alon Vaisman. Welcome to all three of you. Thanks for your time tonight. Dr. Vaisman, we've got confirmed cases in Halton and Durham, 2 possible cases in Hamilton. Dr. Moore today saying, I promise you there will be more cases in this province. So how imperative is it for people 50 and up, as soon as they're eligible, to start rolling up their sleeves?
I think one of the key things to take away from today's announcement and from the boosters is that even if we didn't have the potential of Omicron being a more virulent and more transmissible strain, just for the presence of Delta, it would make sense for that group of people to be vaccinated. I think we're seeing now the numbers for the boosting in the 70 and older group is not as high as we would anticipate compared to how well the vaccination numbers are in the spring. So I think it's very important to people to realize that even with Delta, having that age 50 group and older vaccinated is very important. If you add on top of that the potential for Omicron to be here, then that's even more important for those individuals to get boosted.
Let's jump off of that further then. If you're saying we're not seeing as many 70 and up seniors eager to get their third dose, how much hope do you have that those 50 and up who are just by age, I guess, less likely to become seriously ill, being ready to get this third shot?
I think the two things that are playing in their favor right now to increase the vaccination, which unfortunately is negative news, is that the number of cases of COVID are increasing in Ontario. And the second thing is the increased focus on the variant that's going to be probably more prevalent here in Ontario very soon. So those two things, I think, are starting to get people realizing that it is very important to get the boosters. And we're probably going to see a few more people who were vaccinated earlier on, unfortunately, pick up the virus. And a small percentage of those people have a bad outcome. But I think as we start to see the waning immunity among the older group, people are going to understand the importance of having a booster.
Dr. Vaisman, Dr. Moore, the province's Chief Medical Officer of Health, said today he was asked if the boosters that we have can help fight against the Omicron variant. He said it is absolutely unclear. That science is not out yet, but we certainly think there will be some level of protection. What do you make of that? What do you tell your patients when they hear that?
I think we use our experience based on what we know from the previous variants, which is that the vaccine was effective against very poor outcomes, such as hospitalization and death, in all the other variants that we've seen so far. So it's very unlikely that it's not going to be effective in any way. It's likely that there is going to be effect of the vaccine. It's just that we don't know to what extent the vaccine is going to be effective against this one, and that's because of the concern of the mutations that are found here. So when you think about what you can do as an individual to protect yourself, the most important message to patients is that vaccine is one of the single most important things you can do. Is that even if it offers partial immunity, that's still going to be the most important thing for you to do to protect yourself.
Thank you so much, Dr. Alan Vaisman. We also have Dr. Alan Grill. I actually wanted to direct that question your way. So if you could advise, what do you tell patients as a family doctor when they hear that this booster, well, the evidence is unclear as to the effectiveness of it helping to protect you against the Omicron variant?
Yeah, so like my colleague just mentioned, I think we're not going to know the answer to that question for several weeks. But what we do know is that so far during this pandemic, the vaccines that have been available to us here in Canada have protected Canadians quite well. Your risk of ending up in hospital, your risk of ending up in the ICU when you're vaccinated is significantly lower than if you're unvaccinated. And we've also seen from other countries that have, started booster programs, like Israel, for example, that has significantly decreased the risk of severe outbreaks, especially in those older people that are more vulnerable against COVID-19. And I want to remind our viewers, the Delta variant is still the most common prevalent variant here in Canada and in Ontario. And so we want everybody who hasn't been vaccinated yet or who is eligible for a booster to please get it. It'll protect yourself, it'll protect those around you, and increasing your antibody response can't be a bad thing, considering there is a new variant on the horizon and we're still learning more about it. So I think the message remains clear. Roll up your sleeve, get your shot.
Justin, I'm curious about what's happening now in pharmacies. We heard Dr. Kieran Moore specifically today concerned about capacity at pharmacies, at primary care physicians' offices. You guys are tackling the flu shot. Children are being vaccinated. We've got seniors 70 and up right now getting boosters. Do we have the capacity at pharmacies to tackle 50 and up right now? And how soon do you think it is so we have capacity to drop that age group even further at pharmacies specifically?
Yeah, well, just as our colleagues mentioned, I think it's really important that we focus on the value of getting vaccinated. The messaging this time around for the third shots, I think, can be better. There's still some confusion about who's eligible, and we saw some of this with the vaccination rollout early on, back in March to the early summer. So that public health messaging and messaging from medical experts is really critical. In terms of capacity, we've demonstrated with our partners in primary care and public health that we can get this done. It's really a team approach. We've done 4.7 million vaccinations through pharmacies thus far. We've been preparing for this. We've got additional human resources and capacity to handle this. And the way that it's being rolled out is very prudent. Even if we were to open this up to everybody, 18 plus, we would be looking at a very much a staggered approach, because you would be eligible at that 6-month phase or stage rather, and that is following the rollout the way it happened. So we're not that concerned about the surge, and as we've noted, right now the demand has been less than 50% on third shots, and we want to improve that.
Dr. Grill, how concerned are you about capacity? Family physicians juggling a lot of balls that are in the air right now as well, just taking in-office patients. Again, flu vaccines, kids getting vaccinated. Would you like to see this open up to everyone 18 and up, or are we not there yet capacity-wise?
No, it's a great question. I mean, and yes, I will say that in primary care, we are working a lot harder these days than we were a few months ago. I mean, more patients are becoming comfortable coming to see us in the office because they're vaccinated. So we have a lot more work to do there. We have rolled out flu shots, so there was an extra capacity issue there as well. And, a lot of healthcare workers are tired and burnt out, and that issue isn't going away from a health human resources situation anytime soon. But that being said, as my pharmacy colleague just mentioned, this is all hands on deck. I worked in a vaccine clinic this afternoon at Oak Valley Health. We vaccinated 1,000 adults today with regards to third doses. They were very happy to come and see us. And I think we're going to see more interest as that day 168 comes, and their date comes to get their booster. So I think we're going to see more of that. This is sort of an all hands on deck thing, and many people are being involved. Public health is working really hard. In my region, in York region, they've got lots of clinics planned for kids, 5 to 11, for adults. So we're going to do our best to meet the capacity. And I would say that this government might have to shift if required. So, for instance, if we learn more about the new variant and it turns out that we should be boosting more people, we may have to go back to the planning table and open up capacity even more. But for now, I'm glad they expanded it, and we're going to continue to get the message out there. Come see us. We'll give you your shot. It'll be great, and it'll protect yourself.
Dr. Vaisman, how necessary is a booster shot? Is this just the new reality that, for the next few years, we will have to anticipate that people here in this province and in this country will have to get a booster shot? Or will we at some point, as is the goal, have some kind of herd immunity?
It's a good question. Unfortunately, we don't know the answer to that yet, because we still don't even have the data of what a population looks like with full boosting over a long period of time. So it may be that 3 doses will be enough for a year, 2 years, if the overall number of cases in the world declines and we're not seeing a lot of transmission. However, it may be that the virus will still continue to transmit in high numbers, especially in populations around the world that don't have as good vaccine numbers, and that transmission ends up in Canada, and that we need to keep that boosted again. So the answer to that, unfortunately, is not yet clear. It depends on how many cases there are. And the other thing that may matter, of course, is whether or not we see more variants and whether those variants are significantly different, such that you need to have another vaccine for them. And the similar analogy there would be influenza, where we do that annually.
And Dr. Vaisman, as we wrap up this conversation with our panel and we consider it's actually called a booster shot, I mean, how large is the dose? And when we consider the vaccinations that people here in this province and country got the first time around, first dose, second dose, people were ill from what was the response to the vaccination. In terms of it doing work throughout your body, people were temporarily ill. How large of a dose is this, and can people anticipate just some temporary side effects?
That's exactly right. With the dose being what it is, similar to the previous doses, you're going to experience side effects that you may have experienced the first time. There is changes to the dosage for people when we're considering the effect of males in terms of the risk of myocarditis, and that is probably the most significant increased risk as you get additional doses. But outside of that, as you mentioned, it is temporary symptoms. So what people should anticipate from the third dose is similarly feeling unwell, such as headaches or muscle aches or sometimes chills, but that those symptoms are entirely temporary, and that after about 24 to 40 hours, people feel back to normal. So yes, I think that's a very important messaging for people to understand about the third dose, similar to the first two.
Okay. Dr. Vaisman, Dr. Grill, and of course, Justin Bates with the Ontario Pharmacists Association. Thank you so much. Again, those boosters in the province, you can jump online and start booking in terms of eligibility. It is Monday, December the 13th. Thank you so much.
Thank you.
Stay safe.